Live with Hillsdale Hospital. Today is Wednesday, March 13th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I'm joined as always by
JJ Hodshire, President, Chief Executive Officer, who are in the studio. We are today with an amazing leader here at Hillsdale Hospital. One that I am just so proud of for the work that she has been doing in our surgical services department, which we're going to learn about today, but it's my pleasure. Is this your first time?
No, my second.
Second time on Facebook Live. Now it's called Live. First time is a little different venue, but it's great to have you on Live today. And it's Lauren Schneider. Lauren is our manager of surgical services. We're going to talk a little bit about what that means. And it's just a great pleasure to have you here today, Lauren. Can you tell our listeners a little bit about yourself? I believe you're a Hillsdalean.
Yes.
And
born and raised.
Yes.
Yeah.
Talk a little bit about that.
So yes, born and raised in Hillsdale. When I was a senior in high school, I applied for the
tuition scholarships assistance.
So I received that through Hillsdale Hospital, went on to get my nursing degree, and then started working here, I think in 2016.
Isn't that incredible?
Yep, as a nurse on med-surg, and then transitioned to surgery and kind of found my passion there.
You sure did.
And then became manager almost a year ago.
Yeah.
Wow. I was thinking we were getting close to that.
Yeah.
Done a remarkable job so far. And I'm excited, Rachel, to talk today to Lauren about all the great things that are happening here in our surgical services and things that you, the listener, may not know about yet. So
let's start with what makes Hillsdale Hospital Surgical Services unique, because we do more than people might assume for a rural hospital, right? To the point that we've had some people really asking us, like, wait, are you sure? You really do these things?
Yeah. So we offer, our general surgical services, including general, OB, ortho. We also have urology, which we're expanding upon our services there. ENT for our pediatric patients mostly. And then we also have vascular and most recently neurospine. So we have grown quite a bit. And then, I think our staff is amazing.
They are amazing.
They, we treat our patients as one of our family members.
That's right.
And we want each patient to leave feeling like they are one of us.
Let's talk a little bit more about some of the specifics, okay? Because we can talk about neurosurgery, but what does that mean? We can talk about urology. I want to dive in a little bit if I could. So, we're doing some new and innovative things in neurosurgery. First of all, we have not had this level of neurosurgery at Hillsdale Hospital ever. Now, we did have a relationship before with a neurosurgeon that was practicing here occasionally, but we were not doing anything that was specific to some of the stuff that we're doing now. So you want to talk about who that is, who's working in neurosurgery, a little bit about the types of procedures that you're seeing in the OR.
So we've recently onboarded Dr. Loganathan, who has been incredible to work with throughout the onboarding process. The care that he gives his patients is exceptional.
It is.
We are doing all types of neurosurgery. We have like kyphoplasty. So if they have a fractured vertebrae, we can fix that, from lumbar fusions, decompressions. And then we're also doing anterior cervical discectomies and fusions. A lot of different cases that we see, there's a need for
in our
community. Yes.
And so his practice is at Three Meadows. And now he's doing his surgeries here. Very excited about that. A lot of growth last year in your department. It was one of our best years, Rachel, ever.
Yes. And I think we need to congratulate you and your team and celebrate you guys for the incredible year that you had last year, because a marked increase in the number of procedures that you all did, which, anytime you have a period of growth, there are obviously challenges with that. And your team just rose to the occasion.
They sure
did a
Rachel.
Wonderful job.
They did. And, I think when you think about, how did we get to those numbers? So you had limited staff because, COVID brought us a new staffing model, which was individuals left healthcare in general,
Right.
either to travel or to get out of it altogether. And we experience that. We still do. But your team stepped up.
Yeah.
And you as a leader and your assistant, Jamie Thompson, stepped up. A lot of great team members that did. But, when we talk about some of that growth, those numbers came because of a relationship with, for example, Dr. Alam. Why don't you talk to us a little bit about that service line and what we're starting to do there and what we see?
Yeah, Dr. Alam is our vascular surgeon. We take care of patients. There's a large need for that within our community. But aneurysm repairs is one of the biggest and most exciting things that we're doing right now.
Talk to us about what that is.
Yeah, so that's something that we've never done here before, incredible? Which is amazing.
Which, by the way, I was told that we would never do here.
Yeah.
Isn't that incredible that we were able to do it? Patient successful.
Right.
And that's called EVAR.
Yes.
Endovascular aneurysm repair. I know I get it. Yes. And so talk to us a little bit about what that intervention is.
So that is for somebody who has an abdominal aortic aneurysm. What they do is they go in and put a graft, a stent in there to allow the blood flow without increasing the size of the aneurysm.
And those have been hugely successful here.
Yes.
And we're very excited. So that led to a lot of our growth.
Yes.
Dr. Alam. We also, had Dr. Stockwell and his team. So Dr. Howard is part of that team.
Yep.
And we really just have a great team that are coming here to Hillsdale. Talk to us a little bit about some of the things that are happening in urology, with Dr. Dennis. She is here as well. What are we seeing in that area?
Yeah, so Dr. Dennis has done a few PNE. So those are for our women pelvic floor clinic. We get the referrals from them to help with incontinence. And those have been very successful. Yeah. We've also done PCNLs. So those are kidney stone treatments for patients whose kidney stones are too large to do it the traditional way. Dr. Stockwell has done a handful of those here. And
Peripheral nerve evaluation.
Yes, for the PNE. Yes, there you go.
Very nice.
Yes.
There's all of these abbreviations.
Yes, there is.
A, B, C, D, E, F, G.
Yeah.
So, when we think about what urology is doing, we're thinking about what vascular is doing. It's all really leading to this huge increase that you're experiencing in the OR. And we're seeing a lot of growth in the OR.
Yes.
A lot of exciting things, a lot of new things. And then we think about, all right, you've got Dr. Mucha, who's pediatric and adult ENT. Both of you have experience with her, right?
Yes.
Talk to us a little bit about what are we seeing in surgical intervention for that service line?
We do a lot of ear tubes, especially for the little babies.
Yeah.
And then tonsils, adenoids. She does septoplasties. My daughters who had surgery with her, she was only 3 at the time. And so being on that side of things was very different than being in the OR, being the nurse in there.
Right.
Dr. Mucho was great during the entire experience.
Yeah.
She sits down, takes the time to talk with you, and you know that your child is in good hands.
Absolutely.
With us.
And you're seeing a full gamut of surgical procedures. I mean, we have ophthalmology that's still here with Dr. Gossage. We have podiatry here with Dr. Bidney, and she's doing surgeries. And then we have general surgery, right? So you have 3 general surgeons. Dr. Morgan is new here.
Yes.
I'm sure that's getting busy.
Yeah.
One of the growing practices right now is obstetrics.
Yes.
So GYN, OBGYNs. We have 3 OBGYN, 2 support staff with them that are APPs. Can you talk to us a little bit about what you're seeing in that area? We're witnessing an increase in live births, and they're also working on that GN side as well.
Yeah.
I want to talk a little bit about how you've watched that program grow over the last few years.
Yeah, their growth, their volume is definitely expanding. A lot more. We're seeing hysterectomies. Obviously like the tubal ligations, but we do anything from, LEEP procedures, biopsies to screen for cervical cancer, a wide variety of things.
Absolutely. Absolutely.
So you're clearly very busy keeping all the trains running on time and managing all these schedules with
and all the conductors,
all the different surgeons and all of the work that they're doing. how are we able to pull this off in such a small rural hospital, and kind of defy that expectation that we would be more limited than we are? Because it's not like we're like, well, we might be able to do it. Let's give it a try and see if we can pull it off, right? It's not that we're just barely to the point that we can safely do it. I mean, our patients are having excellent outcomes and experiences. So how are we able to do all of that?
I would say the short answer, and maybe a corny answer, is it's the people. It really is. From the top down. I mean, we have the support from administration, our surgeons, all of our ancillary staff. We could not do what we do in surgery without the help from radiology.
That's right.
CRNA
team, housekeeping,
everybody.
Yeah, blood bank.
Yeah,
the list just goes on.
It really does. Right. And then of course our staff. My staff has been amazing throughout this. And I cannot thank them enough for all the hard work that they've put into it. A lot of hours.
A lot of hours. I mean, surgeries come at all times a day.
Yes.
Weekends. You have an amazing on-call team. Lauren, I want to ask you one last question. I mean, when you look at what you've been able to accomplish, and you're looking into the new year. Here we are. We're already sitting at March. It's hard to believe 9 months left till the year ends. What's exciting for you? What are you looking forward to the most as you really roll out this new year? I mean, is it anything specific?
I am most looking forward to what potential we have. We have a lot of potential within our department for growth. Whether that's expanding our hours, adding on different service lines.
I think you're looking at all that, aren't you?
And maybe our staffing.
There's a lot of great things that you're doing. And we'll be together this week talking about some staffing and some other things. And it's very exciting, the work that you're doing. And I'm so grateful for it. And I believe, one of the things that really encourages my heart is when I'm out and about, and I may have had a really bad day, but it's just last night someone say, you know what? I want you to know, JJ, your surgery team did a great job. I had that last night. I had a X procedure done, and man, they were just so great, and the communication was great, and the outcomes were great. And that happened last night, right after a board meeting that I had. And so it's great really to hear, the fruits of your labor, are the dividends that are in the community of people just really spreading the goodwill about the surgery interventions that they've had and the service that they received at our hospital. So none of that's possible without a leader. And you've done a wonderful job in really raising up our OR team. So thank you for your contribution.
Yes. So let's see. Do we have any questions from anyone watching live?
We have answered them all, Rachel.
Perfect.
Isn't that awesome?
We have.
Well, as always, we like to close by thanking you, our viewers, our supporters, our patients. Because of you, our hospital stands free and independent still. In today's very tough economic times for hospitals, many hospitals either closing, divesting programs like we are witnessing with Coldwater and other hospitals in the region. I'm not afraid to call them out, who are eliminating much needed services. That's happening because of the economy that we're in today, in the state of affairs in healthcare. And so those divestments are occurring all around us. And we're able to stay free and independent because our patients use our services, that you trust us to use our services. And when you think bigger is better, at the end of the day, it's not. You can look at our quality scores, look at our pricing. So pricing, quality scores, and then the connection that Lauren speaks about. It is the people. It's those that you go to church with. It's maybe a classmate you went to school with. Maybe it's someone who you see occasionally at your child's events. Those who are taking care of you. And that's a special bond. Because when you walk in, you have that familiarity of, and you felt that, Rachel.
Oh, yeah.
Going and delivering, someplace you didn't know, to delivering here at Hillsdale. You shared that experience.
Night and day difference.
Night and day.
Yeah. I think we're actually doing a live stream on that in a couple weeks.
Yeah. And Lauren was talking to us earlier about, her grandmother who had some services. And so it's really just knowing to have those familiar faces means so much. But that is because we invest in you, you invest in us. And you do that through a variety of ways. Number one, you can volunteer. Number two, you can make a contribution to our capital campaign. You have to throw that in there. Number three, you can become an employee of ours. And the great opportunity is not just use our services, but also become a member of this amazing award-winning team here at Hillsdale Hospital. And plenty of job opportunities on hillsdalehospital.com website under career tab. You can find those jobs. You don't need to be master or bachelor prepared. Many of these you entry level, and then we can move you to other departments, get your certifications, help you achieve your education. You know, Lauren is a product of coming and interviewing. I believe I was on that panel.
I think so.
Coming and interviewing, and look at her growth here. It's been remarkable. She's leading a department now. So the opportunities are endless for you. Go to our website, hillsdalehospital.com. Also, stay tuned to us. You know, it's so important to keep your local hospital and what's going on very close to know we do offer neurosurgery. We now do offer vascular surgery on the inpatient side. We do offer, you know, these services and these services. It's real important for you to stay connected because you do not have to travel. You can get your PET scans here now. You can have all of these services right here in your backyard. Support your local hospital, receive great care at a lower cost, and everybody wins. We sustain this local economy for years to come. And so we invite your trust to continue to use us. If you've not used us, because maybe an experience a decade ago. We've changed, folks. There's been a lot of change. And if you don't feel we've changed, see Rachel or myself or Lauren and have a conversation about what has changed. We'd love to hear from you. And you can hear from us every Wednesday on episodes like this on live. Also, we have a Facebook site where you can go and learn about the many press releases that we offer, the many opportunities that we have to introduce new services and providers. Yet this week, I believe, Rachel, we're going to be introducing a new provider in primary care. And so you can stay connected on those social media platforms, as well as we have opportunity for you on Rural Health Rising every Thursday that we have a podcast. This is really a larger audience, but still we would encourage our local audience to listen to that because they're issues that we're trying to elevate at a national level, talking about the sustainability of rural health in America. How do we save rural health? And it's really a dialogue about that. And then every Friday, WCSR 92.1, a radio segment, which talks about things that we are talking about here on live. So until we see you back again on one of these venues, one of these platforms, at one of these times, maybe it's a social event we'll see you at, we want you to stay safe, stay healthy, and stay Hillsdale strong. Thanks for joining us.